Vanakkam, I am Dr. Sujay Susikar, Senior Consultant Surgical Oncologist at Kauvery Hospital, Alwarpet. We know that head and neck cancers are among the commonest type of cancers which are seen worldwide. What are the causes for these head and neck cancers? The commonest type of head and neck cancer is that which arises from the lining of the aerodigestive tract or the lining of the mouth, nose and the throat. These are caused by exposure to carcinogens or which can be because of exposure to agents which cause cancer. And the commonest ones which we see today are smoking, the tobacco in the smoke, and the second thing is chewing tobacco and exposure to other carcinogens in either betel nut, betel quid or other chewable tobacco forms, and also exposure to smoke and other pollution which can lead to cancers of the aerodigestive tract. The other causes of head and neck cancer can be because of exposure to radiation. Exposure to radiation can happen because of either exposure to radiation calamities, like in places where nuclear disasters have happened, or because in patients who have been previously exposed to radiation of the head and neck for treatment of other forms of other diseases or cancers. And the third one is, one interesting fact which happens in certain head and neck cancers is because of exposure to viruses. One among them is the Burkitt's lymphoma, which happens because of exposure to the Epstein-Barr virus, and the other one is, which we are seeing commonly today, is oropharyngeal cancers which happen in the throat, which happen because of exposure to the human papilloma virus, which also causes the cervical cancer in women. So the various reasons for oral cancers are exposure to carcinogens like tobacco, either in the form of smoked tobacco or smokeless tobacco which is chewed. The second is other carcinogens like betel quid and also betel nut and betel leaf. And the third one is exposure to radiation, and of course viruses like the Epstein-Barr virus and the human papilloma virus, which can also cause certain head and neck cancers. Thank you.